Hi, my name is Frances Price, excuse me, and I am making this video for final, my final paper option for abnormal psychology in movies and in TV. I watched portions of different movies over the years, and several years ago when I was younger, and I want to go back and watch those movies again because they leave a strong, I still have strong feelings about some of the movies. Some of the movies that I've seen on the clips, I've seen before, so I can go by some of those. And I do believe that Hollywood has some, fortunately now, has some positive performances that are believable. But since it is Hollywood and they are depicting so many different types of mental disorders, and I don't believe that they're going strongly by what the different disorders are, the symptoms of the disorders and the way a person reacts to these orders. I appreciate that they're trying, and then it might give someone a small window in to see how some people react to different disorders, how some people feel having these different psychological abnormalities. And but unfortunately, like I said, it's Hollywood, and they of course try and dramatize things a lot more so that the person or the disorder is Hollywood. It's full blown, and if they have an anxiety attack or PTSD or just a meltdown, they make it seem like it's extreme and tragic to everyone, unfortunately, and it's not always like that. There's different levels of people's disorders. They can have, I've seen people in my life that have a severe disorder, and you can tell by speaking to them on a daily basis that they do suffer, and they do have real fear, and they have a lot of trouble without their medications. I worked at a facility where they handed out medications to people, and they didn't go to the clinic for these people, and unfortunately some of their medications weren't picked up on time, so they went through the whole weekend without medications, which is not a good idea. I personally have PTSD from some tragedy in my life when I was younger, and ADHD, which I am learning, and fortunately in this class with our amazing teacher, I'm learning a lot more about it, and we actually spoke about the disorder in our classroom. And there's another student who said that she also has some complications due to ADHD. There in the movies there is different depictions of OCD, bipolar disorder. They have different anxieties, panic attacks. They even had a superhero, Iron Man, having a panic attack. I guess being a superhero must be difficult. I'm not trying to make fun of it, but it must be difficult because all the things that he has to accomplish, and he can't let people down because so many people are some people are so dependent on him, so that is also part of the problem. And they also depicted in another movie Jackson, depression and anxiety, and how much it hurts somebody. I can understand that because I have depression at times. I experience depression due to tragedy in my family, and I found different ways to hide it in front of people, unfortunately. And I am going back to counseling, and I will talk to a counselor about different things that have happened in the last few years. They have people that are bipolar in the movies and that have tried to commit suicide, and they also depict people with PTSD, and also one of the movies talked about PTSD within the Latino community. I can understand this because since I was like 15, the majority of the people that were around me were Latino or Mexican, and from different countries from South America. They go through a lot. Their parenting is a lot different. Either you're really, really spoiled and then they'll hand feed you, and then there's the complete opposite where the parent, mostly the father, will beat the child, scream at the child, do so many different things to abuse the child. And it's common, unfortunately, like within the Native communities, that they have sexual predators. I have known several people that have had sexual predators in their life, and that person still goes around them and hangs out at family events, and other children being molested, and that unfortunately happens in the Native community also. And it talks about people with PTSD trying to get help. I know my father had it, and in those years, it was a lot more difficult to get assistance, especially in the Native community in the 50s, 60s. We didn't have funding, we didn't have doctors, we didn't have really a lot of resources that could help him with his post-traumatic stress, and then that increased his alcohol use, and he would go on binges. Anyway, that's some of the family issues that came along. And it spoke of the anxiety that causes the panic disorders. And you can also, even if you have this was a good movie, talking about the person was actually a good parent. Even if he had a mental disorder, it doesn't mean you're going to be a horrible parent or a horrible person in any way, because just because you have a mental disorder doesn't mean that every disorder that someone has is going to be completely debilitating and they're not able to function normally. They can get medication, they can get treatment. Some people don't even have to get medication. They're able to work through their issues and understand them, and the panic attacks can lessen, and the person can eventually work through their issues, and it helps a lot. And I do recommend to people getting counseling. Unfortunately, I lost a family member to suicide, and my daughter, that was her husband, and I raised him like he was my son. And she went to a treatment center, and it was an amazing place. It's extremely expensive, and I thank God that our tribe had funding to send her to this type of place, because it helped her quite a bit. She's on medication to help with her depression and deal with her day-to-day life and take care of her children. She's an amazing parent. She always thinks of her kids, and she spends time on herself, and they'll go on trips with her sisters and brothers, and she'll spend time with her family. And I think of her as an amazing and strong person. And like I said, just because someone has a mental disorder doesn't mean that they're completely disabled. It's not always like that. And a lot of people think, oh my God, she has this, and be careful around that person. And unfortunately, that happens. Also, you can be an addict. You can be different types of addiction. A drug addict. There was another movie that depicted a person with different types of addiction: drug addiction, food addiction, sex addiction, and they had a borderline personality disorder. I've seen people with this disorder, and addiction, I believe it coincides with it actually not coincide, it goes, it is a reason that people have these disorders. They are trying to mask their disorder or their feelings or not feeling anything, so they use drugs to, illegal drugs to cover up their feelings. And once they start coming off, or the drugs wearing off, then a lot of times they start feeling again, start hurting again, start realizing how bad their life is, and they go back and use again, and then all of a sudden everything is bright and cheery again. But I don't believe it'll be bright and cheery, but at least it's numbing their pain and their addictions and their sometimes fear, or it numbs the memories so they don't have to feel this. Also, getting a diagnosis now is so much better, so much easier than it was so many years ago. Growing up, I was afraid to talk to anyone until I was in my early 20s, and due to my unfortunate incarceration, I was sent to talk to a psychiatrist and a psychologist. The psychiatrist, I didn't, tell her my whole life story so that she would prescribe me several things, which I see a lot of people in there do. And then they walk around kind of like in a dream state where they don't really see where they're at or deal with their issues. But I did talk to the psychiatrist, and we had group meetings, we had personal meetings. I didn't get any drugs for mental disorders. She at least I was able to tell her about being raped when I was a child, and getting that out surprised me because I've never told anyone before this. And it felt like a weight was lifted off of me. I was happy that I finally said it to somebody, and later on in the years I told my sister about what happened to me, and she was outside drinking with the person, and he crawled in my window, and I was very young, and my sister was sleeping in my room with me. I have two sisters, and I dragged her out of the room after, so he wouldn't do anything to her. I told my sister, she had nothing to say. Unfortunately, this happens a lot in my family. When I was growing up, my mother would listen really well. You could tell that she could hear what you're saying, understood what you were saying, but she would not give you a response or talk about it. We were always taught, don't talk about it, quit talking crazy. Unfortunately, I did tell her I used to drink, and it's been a long time, but that's something I told her about, and then she just kind of, like I said, just looked at me, and that was about it. And getting a diagnosis really does help. Then you realize the different types of things that you can work on to help with your issues that you might have. The deer hunter spoke a lot of PTSD. They had memories of war, and I do understand people have flashbacks. And I met someone that was in the Gulf War, and he would sleep, and during his sleep he would have dreams of he was still in in the bunkers, and he had injury on his ear from the bombs going off, and he had to deal with quite a bit. And there was another person that was an introvert, and schizophrenia. You can have more than one disorder. That's what I want to talk about with my counselor when I go back in. I'm working on it, but also the last few years I started menopause, and that's not a mental disorder. It's something that happens to most women, and it does make your hormones go out of whack, and it would make me really stressed out, really emotional, tired. There was a whole lot of things that I figured out after a couple of years of the hot flashes, after those wore off, that the feelings that I was having was because of menopause. It wasn't all just me having an anxiety or a bad day, or it was also because of menopause. And I seen people having mental breakdowns after living their whole life with really difficult parents, and they're really strict with them. They're not allowed to live their own life, and then they have a schizophrenia, and they have a complete meltdown or a mental breakdown, and they were admitted into different psychiatric facilities. I've seen scary movies about different psychiatric facilities, and I do understand there's good places and there's bad places. There's places where the nurses and doctors treat people really badly, or they keep them all heavily medicated. And I know there is good places where people go in and actually get help and they're released. And depression is real. It doesn't mean that you're going to be depressed the rest of your life. It means that you're going through depression, and a good counselor can also help with this. And I've seen different mental institutions. Unfortunately, I had to visit my son in one after he tried to commit suicide. And he was diagnosed with he is with depression and bipolar, I believe. And there was also, like I said, OCD. People, like we've spoken one of our groups, people say, oh, I'm OCD, and it's a trendy thing. It's not. It's it's difficult to live through. ADHD, I have things that are cluttered, but I know where everything is. I try and put it away, then I want to pull it back out again. I'll buy things that I don't need. I'll go shopping for things that I don't need. I'm trying to work on that. If I'm not going to need it, I don't need to pile it up for somebody else to have to get rid of eventually. I've seen people that are bipolar, and I see how their temperament, they can be extremely nice at one moment, and then at the next moment they're accusing you of things and going irate, which is difficult. I can understand. And being paranoid, it must be really difficult to have schizophrenia and feeling like you're being followed at all times. I've seen people like this, and I've seen them like this on drugs also. And there was a mention of a show called Sybil that was a person with several personalities, and it was due to horrible things that her parent put her through. And she raped her child, she beat her child, she would hang her up by a rope and leave her there for hours, lock her in a box. And this is what I watched when I was young. This video is getting a little long. Anyway, I really enjoyed this class. I'm so glad I got to take it at the end of my my courses so that I can remember these things. I don't go around and try and diagnose people because I'm not at all qualified to do something like that. But I can see symptoms. I'm not going to run to somebody and say, you might have this, because I cannot diagnose anyone in any way. I could just, this helped me to know different diagnoses that people give me if they want to. I never force anyone to. I tell them what I have so they can understand. A lot of people, they don't understand. They tend to like judge people, or maybe I'm just thinking that. But I do believe that the people need to be more educated with an actual movie. Some of the movies, like I said, were really, they displayed really good, the actors displayed the disorders really well so that people can understand. And like the horror movies of psychotic people chasing you and killing you, those are scary, but yeah, that's what the movie's supposed to be like. And I can understand why a lot of these movies got Academy Awards, because the actors did a really good job. They're able to put themselves, an actor or a good actor can put themselves in that person's mind and understand that they're acting this way so that people can understand it. And I know a lot of them study all of the disorders so that they can understand and show everyone exactly what they're feeling and understand what the movie's supposed to be about. This is getting long. Okay, like I said, you were an amazing teacher. You put up with me for so long. Excuse me. But I will post this on YouTube and I will send you the link. And this is June 9th today, and I appreciate all your help. Excuse me. And I thank you, and I hope I gave enough information of everything that I've seen about everything. All right, thank you.